This is the fourth in a series of presentations on the topic of disorders that predominantly affect the diaphysis, metaphysis, and physis in veterinary patients. In this presentation, we're going to talk about an unusual disorder titled hypertrophic osteopathy. And although this is not a common disorder, it has a pathognomonic appearance that you should be able to recognize. So by the end of the presentation, you should be able to identify and describe the radiographic findings of hypertrophic osteopathy and make a recommendation for further diagnostics. As a quick aside, be sure that you do not confuse the name for this disorder, hypertrophic osteopathy, with the previous growth disturbance that we talked about titled hypertrophic osteodystrophy. So hypertrophic osteopathy is what we'll emphasize in this presentation. Hypertrophic osteopathy, sometimes called HO, is a generalized osteoproductive disorder of the periosteum that affects the long and short tubular bones of the extremities in many species. It's been described in the dog, the cat, the horse, the donkey, and even in people. This typically commences in the distal limb and then moves proximally. Hypertrophic osteopathy is generally secondary to a thoracic mass or cardiopulmonary disease. And the thoracic mass can be of the lungs, the pleura, or the chest wall. And it can be neoplastic, but doesn't have to be. It's also been seen in patients with fungal pneumonia, intrathoracic foreign bodies, and parasites such as Dirofilaria and Spirocercosis. HO has also been seen secondary to abdominal or pelvic masses, particularly when they're of urinary origin. The pathogenesis is incompletely understood, but some theories are that it may be due to increased blood flow at the level of the periosteum, that it may be neurogenic in origin, such as associated with vagal nerve stimulation, or that it may be hormonally mediated. And keep in mind that sometimes hypertrophic osteopathy is found incidentally in patients presenting for thoracic disease, so you'll actually see it on the thoracic radiographs affecting, say, the humerus, or the patient may actually present for the swelling and pain of the affected limbs. Radiographic findings are predominantly of a semi-aggressive periosteo reaction, which can be solid, lacy, or palisading periosteo reactions. It is important to note that hypertrophic osteopathy does not have any associated lysis. The periosteal proliferation is usually bilaterally symmetric, can affect the front and or rear limbs, and it usually commences in the metacarpal or metatarsal bones, oftentimes affecting the abaxial aspects of the second and fifth metacarpal or metatarsal bones. Typically, the joints are not affected, so it kind of spares the joints, and then, as I said, it progresses proximally. Soft tissue swelling is not uncommon, and as I said earlier, sometimes these patients, it can be quite painful, so they actually present for the lameness, pain, and swelling. Here's an example of a 14-year-old boxer who has hypertrophic osteopathy. And we have orthogonal views of the front limb and orthogonal views of the rear limb. And if you notice, especially I'll draw your attention to the front limb here on our dorsal palmar view. Here is that kind of irregular, lacy, palisading periosteo reaction that has started on the abaxial aspect of the fifth and abaxial aspect of the second metacarpal bones. However, there's a little bit of periosteo reaction on other metacarpal bones. And then it typically kind of spares most of the carpal bones, but then you can see it on the radius and the ulna, and you can see that it's circumferential. Then there is associated soft tissue swelling. Same patient in the pelvic limb. Let's look at the DP view here. We can see it along the fifth metatarsal bone. In this patient, it did actually affect both the talus and the calcaneus here, and then we can see it in the fibula and the tibia. This is the same patient. In the pelvic limbs, it actually has progressed even into the femurs here. It's more of a solid periosteal reaction. And in fact, I think we can actually see it on the body of the ilium here as well. And this patient, if we notice the thoracic radiograph here, has a large mass that is in the thorax along with multiple pulmonary nodules, and then probably some pleural disease with pleural effusion. In this patient on the thoracic radiograph here, we can also see that hypertrophic osteopathy that's on the humerus. Here's a cat. This cat, if you look to the right of the slide, has a large thoracic mass. And on both the front limb and the rear limb here, we can see this kind of lacy, almost palisading periosteal reaction that's affecting metacarpal bones. The radius, the ulna, goes more proximally on the radius and the ulna up into the humerus. We can actually see it on both of the humeri here on the thoracic radiograph, and then it's affecting the metatarsal bones, probably went into some of the tarsal bones and the calcaneus here, and then up the tibia as well. So this is very classic appearance of hypertrophic osteopathy. And notice that we do not have any lysis associated with these lesions. And keep in mind that you don't want to confuse superimposition of this periosteal reaction causing relative lucency with actual lysis. So hypertrophic osteopathy will not have lysis. Here's another example of a cat that has a large thoracic mass. It's displacing the trachea here. I'm not exactly sure if it's in the mediastinum or lung, but on the thoracic radiographs, this patient also has this periosteal reaction, kind of a combination of solid, lacy, irregular on both the left and the right humerus. Probably has it down in the more distal limbs as well, although we can't see those. And this is no lysis, just periosteal proliferation, classic for this hypertrophic osteopathy. And then our final example, this is an adult beagle who actually presented for lameness. They were painful and swollen, both front and rear limbs. And so there were some radiographs taken of the limbs. We can see in the thoracic limbs, all of this periosteal reaction on both the limbs, radius, ulna, up into the humeri as well. And then on the pelvic limbs, here's some of that periosteal reaction on our second and fifth metatarsal bones, on the calcaneus. I can't tell right now if there's anything on the tibia or the fibula, but there is a solid periosteal reaction on the femur. So the important thing is to recognize that the cause of the lameness and swelling in this patient is this classic appearance of hypertrophic osteopathy. And then we'll know what to do next. So the first thing we should do is take thoracic radiographs, because we know that it is usually secondary to thoracic disease. And if we take thoracic radiographs and don't recognize a thoracic lesion to lead to this hypertrophic osteopathy, then we'll take abdominal and pelvic radiographs to assess there, or we could assess the abdomen with ultrasound. If you want to read a little bit more about this disease and see some other examples, you can consult chapter 21 in the pages that I've listed here. Again, not a very common thing. I see a handful of these every year. You might see one or two, every couple years, but it is something that is pretty pathognomonic. And if we recognize it in the limbs, we need to know how to further assess our patient for disease.